Hello everyone, my name is Joanna. In this video we will talk about cardiovascular disease and Muslim culture. I want to start asking you a question. How many of you are well informed about cardiovascular disease and how it's related to a Muslim culture? Well, recently, especially in America, we have heard that cardiovascular disease has been the killer for many people. And we have heard also that 1 in 5 people have died as a result of a heart disease in America in general, but also in Philadelphia, in the city that we are living in. Cardiovascular disease are divided into different types and are caused by different consequences. In this video, we will inform you about what this disease is, what are its symptoms, how it's related to a Muslim culture and religion, and we will inform you with some important information that will help you in your daily life. Cardiovascular disease are conditions that touch the structure of heart, where we can mention Marfan syndrome, arrhythmias, aorta disease, or abnormal aorta rhythms. Some symptoms of the cardiovascular conditions are sweating, discomfort, pressure, heaviness, pain in the chest, arm, or below the breastbone, or a faster heartbeat. If you have these signs, it's better for you to have an appointment to the doctor so you can understand in time from what you are suffering and to get the right treatment. According to the Muslim Coach Live, we learned from Quran that it's said and believed that the road of the badness, heartburning, and sin it begins with ingratitude. From this sentence, we understand that in Islam, clean the soul and the heart from these bad emotions is very important. Allah says in Quran that in their hearts is disease, so Allah increases them in that disease. I also want to tell you some long terms about health consequences of cardiovascular disease that are stroke, heart failure, high blood pressure, and heart disease.
Hi, I'm Lisa Rose, and I'll be talking about different ways Muslim uses plants and herbs for healing purposes. But before I get into that, Muslim believe in a phrase that was said by their Prophet Muhammad, that God has provided a remedy for every illnesses. Then they just leave everything up into God's hand. But they believe in spiritual healing. Praying is one of their most stuff to do. Yes. Praying over plants and believe it just can heal them is most likely what they do. But spiritual healing is captured by the soul of who's praying, causing an encounter detached from the divine. Spiritual healing is neither magical or mysterious, but in fact it is natural. They believe they're gifted with praying ability. Yeah, they believe they're gifted with praying ability. They believe praying to their God will heal them. But they also believe in these local plants at the corner store, such as pumpkin, black seed, ginger, garlic. They believe those can cure their illnesses. Black seed was mostly used for heart diseases. So most Muslims, in fact, use garlic, black seed, ginger for their diseases.
Islam is a religion practiced by Muslims who have a very different and interesting views on health. So their perspective on the human heart is at the core of one, spiritual, and physical being. Muslims do represent a large group of people around the world who have showcased a unique set of lifestyles, habits, and traditions. Muslims do believe that cardiovascular disease comes from a very poor diet, right? And so, basically, sorry. And basically, for example, Muslims prohibit, the fact that they don't eat, pork and drink alcohol, works in their favor with, the fact that they really try to, they take care of their health. There is a need for Muslims to eat pure food to attain, a very healthy heart. This would pertain to, avoidance of fast food and bias towards home cooked meals.
I also want to talk about language and language barriers. Language is the key to communication, and if a patient does not speak the language of the country that he is living in, it will be very difficult for him to explain the health problem, and also it will be difficult to understand the treatment of the disease. Cardiovascular disease have specific words and different terms, so if the patient does not know the language, he will not be able to do the proper treatment of the disease. At the same time, it will be a problem for the doctor because he will try to explain this disease in simple words, or he has to remove the key terms that should be used to explain this disease. And still, in the end, he will not be able to understand if the patient understands the doctor or not.